Hello, my name is Jonathan Smart. I work for Innosone in Europe and we manufacture the Brayden range of mannequins. I'd like to introduce you to the newest addition to our family, which is the Brayden Baby. The Brayden Baby mannequin, and here he or she is, was specifically developed using help from European and global key opinion leaders for the European Paediatric Life Support course. It has feedback. We're using intuitive lights for both chest compressions and for ventilations. Information about that feedback is covered in another video. But we looked at the baby working with key opinion leaders to see whether it could be used for the newborn life support course, or as it's called now, the resuscitation and support of transition of babies at birth course. And I want to go through this short video to show you how the baby can actually be used for the algorithm that is used for that particular course, the old newborn life support course. So as I'm sure you're aware, the first 5 inflation breaths for the newborn life support algorithm are subtly different from normal ventilations that you would use in EPLS or later on in the NLS algorithm. So they need to be given over 2 or 3 seconds, they need to be sustained, and the Brayden Baby, although it was designed for normal ventilations, can be used to show whether the inflation breaths are being done correctly. So in this case now, because you're giving over a longer period and with a slightly higher volume, the lights will flash on the mannequin. So I'll demonstrate. 1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3, 5, 2, 3. So at that point, you would then now reassess. The 5 inflation breaths can be given using a bag valve mask, but they can also be given in a hospital setting using a resuscitator or a continuous positive pressure device with or without PEEP equally well. So after reassessing and there's no increase in the baby's heart rate and the baby's not breathing, then the NLS algorithm states that you should do 30 seconds of normal ventilations. These are ventilations which are over 1 second, and you should be doing a ventilation once every 2 seconds or so, and then reassess after that. This is what the Brayden Baby was designed for from a ventilation point of view, so this is very simple. So using an intermittent positive pressure device or a bag valve mask device, then you would gently squeeze the bag, and every 2 seconds or so you would be squeezing the bag slowly over a second to see the lights illuminate in the normal way. We've tested this also using a positive pressure device like a resuscitator and a T-piece, and it works fine. It works great in terms of the lights coming on when the T-piece and the resuscitator are being used. So after reassessing again and there's no increase in heart rate, then you would consider, according to the NLS algorithm, doing compressions and ventilations ratio of 3 to 1. So you would ask for help, somebody would come, and the compressions that you would then perform, well, there's only 3 of them, would be at the rate dictated by EPLS, which is to 100 to 120, with a depth of 1/3 AP or 4 centimeters, with full recoil and finger thumb position. This, the Brayden Baby will allow you to do. So using the 3 to 1 ratio, you would keep going and reassess every 30 seconds. So I think you've seen that the Brayden Baby, although it was designed specifically for EPLS, with the conversations we've had with various key opinion leaders, it can play a useful role for the newborn life support algorithm, and will play a useful role in terms of giving feedback of CPR, both compressions and ventilations, with the NLS algorithm.